Hi, everybody, and thank you for joining us today. We're so excited to have you visiting with us and learning a little bit more about how human trafficking and the public health awareness is very much needed. And also, we're about to announce the launch of our iCare advocacy line that Angel will talk a little bit about later. So first of all, my name is Wendy Elliott. I'm one of the co-founders of Elite Foundation. Elite Foundation has been around since 2016, and we work on co-creating a future for every survivor. We're working particularly with sexual exploitation and sex trafficking with adults and minors. And we're so excited that we have so many services to talk to you about and to offer you and anyone else that's interested in knowing more about us. Just go to elitefundsfreedom.org and you can see everything that Elite Foundation is doing. I've been a part of this foundation along with the founder, Dr. Jessica Vera, for quite a few years. And, you know, the story of it, you can find out on our website, but basically Dr. Vera was working with children and just all of a sudden noticed that there were a lot of children that she was working with that was being trafficked by their family members or being trafficked by people that they knew. And it happened here domestically within the United States. And it's not just something that happens outside of here. This is happening here and now. And she called me and she's like, we have to do something. And I'm like, I really don't know anything about this, but I'm on board. Let's do it. You know, anything that we can do. And I wanted to support her initially. And then all of a sudden, you know, my goddaughter, her daughter, began being phished by people on the internet that she thought were boys her age. And all of a sudden, we were planning on meeting them and wanted to go and visit with them. And you know, it was like a whole different world out there. And I said, you know what, that's it. I'm done. We are going to do something that we can to prevent this from happening to any teenage girl, any teenage boy, or even, you know, vulnerable women and adults that, you know, can be coerced or that can be manipulated to be into this type of environment. And we just had to do something. So we created the Elite Foundation, which, you know, to this day, it's been God's work. God has taken us and he has taken us to a new level to where we've been able to create more and more resources and more opportunities for those survivors that we deal with every day. So, you know, with that being said, I'm going to let my colleague, Angel Carter, introduce herself and what she does with the Elite Foundation. So Angel, take it away.
Hi, I'm Angel Carter with the Elite Foundation. I'm the Victim Advocate Care Manager for Elite. I'm so excited to launch today's care line. I'm a mother of a daughter who was trafficked, and I'm also a survivor of human trafficking. So I'm looking forward to what's to come with Elite and to bring you guys into our life and our family.
Thank you, Angel. So welcome to be here. And we're so excited to have Angel working with the Elite Foundation and all the things that we're going to talk about tonight in the launch of our iCare advocacy line. But what we want to talk about today, and this is January 11th, which is an acknowledged day of awareness for human trafficking and all that can happen with that. But in particular, you know, we want to talk about the public health crisis. I mean, right now we're going through a crisis with the COVID-19, and we're going through, you know, the information that's happening within our own walls, within our own environment, our community, of things that we really didn't think about that would happen with a pandemic of such. You know, as the pandemic has increased, you know, we've had restrictions, we've had regulations, you know, you can't be around people, you have to socially isolate, you know, you can no longer hug people, you can't go out into gatherings. So that in itself creates a whole other pandemic than just getting the coronavirus and attaching that to yourself. I mean, this creates a whole other environment. And then you put upon that pandemic with social isolation and people who are already being vulnerable and in an environment to where they're already exploited. it's just a whole different atmosphere. So what I hope to do tonight, and I'm going to share my screen here in just a minute, but I want to go through how the COVID-19 has really impacted our public in more ways than one. And then as a healthcare provider myself, being able to look at things a bit differently and how we can help prevent and control more, what's happening to our youth and our vulnerable in particular. So give me just a few seconds right now. I'm going to pull up my presentation and then we'll hit it from there. Okay, so tonight we're going to talk about human trafficking and the COVID pandemic, which is obviously a public health issue or a perspective that's very, very problematic. And so from this perspective, again, this started in March in the United States anyway. I mean, it started elsewhere before that. But in March of 2020, we saw our first case of the coronavirus, which devastated all of us. We didn't know what to expect. We didn't know what to do. There were so many things that were going on from a healthcare perspective, from a community perspective, that we were just trying to figure out, what do we do? Do we wear a mask? Do we not wear a mask? Is it safe to be around people? And so forth. And I think the last 8 to 10 months has really, really shown us the resiliency of a lot of people, and in particular, how prevalent this virus has been. And in the meantime, it also created a whole other component of things that are retrospectively things that we should have been looking at to begin with. So I'm going to talk about in general, the pandemic, but also how it's impacted the human trafficking aspect of things as we go through this. So, what we do know is that there's a greater impact of the pandemic on the marginalized population or working in the informal sector. So what I mean by that is, the folks that may be lower socioeconomic, the already workers that are out there in the sex trafficking field, and also folks that are, homeless. So those are the ones that I'm going to talk about in particular. But also, what happens is that there's more of a danger due to the health impact and the societal efforts to control the spread. So in the nature of what we're doing to control the spread of the virus, we've asked people to socially isolate. We've kept the kids from going to school. So now they're in the homes that they normally may have had some reprieve from by going to school every day. The folks that are homeless already, now they're having to go into areas that are closed. I mean, how are they going to be fed? How are they going to, be able to do the things that they normally do and live and fulfill whatever it is that their needs are at the moment? Sometimes they're accepting jobs that don't use the fair labor practices because their jobs may have been eliminated. Look at all the jobs that were eliminated from a factor of working in the hospitality industry, the restaurants, the hotels, anywhere where people congregate, their jobs were eliminated and they were told to stay home. So those folks, jobs were done. So now they're having to go into areas which may not be fair labor, who don't really care about their well-being. And then also they may be deceived and exploited when answering the online ads for employment. They're so needy of earning money and needing to have a living expense for individuals to keep themselves going. So now they're going to take any job that might provide them a little bit of income. So, we have to be mindful of what that looks like. There's also dangerous health conditions or situations that facilitate the COVID transmission. Again, if you're in the sex trafficking world and you're being in contact with someone, there's not necessarily the PPE or the protective equipment that we normally would use, where you wear a mask and you wear gloves and you use sanitizer, so you have to really think about how that might exemplify, being able to contract the virus even more so. And it's less likely of being able to get the vaccine. So right now we're in a crisis of how we can get the vaccine out fast enough. First it's the frontline workers and the over 65 population, and the population that has some predisposition for being able to be vulnerable from a healthcare perspective. Well, who's going to advocate for those that are out there, not able to get the vaccine, to get the immunity that they need? Also, our health system are overwhelmed with limited resources. You see on the news every day, the nurses and the doctors that are dealing with the COVID patients that are in the ICU and that are very, very sick, that are being admitted into the hospital. They're very, very stressed out, and they're having to cope with this every day. So they're overwhelmed. The overwhelmment of the social services agency trying to find placement that's safe for our survivors or the victims that are still out there. And then obviously our understaffed law enforcement agencies who are there to protect and to serve. So those are the things that we need to really focus on and think about. Those resources that we normally would have are no longer there. So how do we continue to protect those that are vulnerable and be able to say, I care about you, I want you to be better, and we're going to fix this when we can't even help the folks that are not in that situation. And so what are the pitfalls of the lockdown? I talked a little bit about those things that are creating some indifferences and some things that might have people suffer. When you think about the increased rates of the intimate partner violence and child abuse, think about it. If you're already in a situation where you're in an abusive relationship, or you're in a relationship where your spouse is very abusive to your children, or potentially someone who's on drugs that are abusive to the children as well, it's like they're now stuck at home 24/7 with their batterer, someone who's really impacting them on this regard. So there is no ability to get away. Children are spending more time at home because the schools are closed and they're doing online, and they become vulnerable in their own residences. And this is not just with their parents. Parents have to work. So if they do have the opportunity to have a job that's outside of the home, the children oftentimes are left at home by themselves. So again, we're going into the lock-in, where, we used to lock in our children and wish them luck as we went off to work. So the neighborhood, their neighbors, their, friends that come over to visit and sneak in, they're becoming extremely vulnerable to abuse and potential sexual exploitation. Mm-hmm. And then those that actually are considered the commercial sex workers, they're taking more risk because of the lack of buyers. Now their regulars are staying at home because they don't want to get COVID. So they're being presented to folks who really don't care. And who are those? Those are the drug addicts, the folks that really don't care if they live or die, and they don't care if they're being abusive. So these are the folks that we really need to protect them from. And even the traffickers, the ones that are exploiting the children and the vulnerable, they are compelled to send the workers into greater danger because their profits have decreased. Again, the folks that are buying are not buying anymore because they want to protect their family. They don't want to get COVID and they don't want to expose themselves. So the traffickers are sending them into more dangerous situation to where they really don't have a lifeline to help save them. Shelters are limiting their services. Again, either they're full, they don't have enough equipment to, protect anyone that's there, or they don't have the financial resources to do that. So they're having to limit the ability to take on anyone new coming in. And law enforcement, the frontline responders, who oftentimes are the ones that save, those folks that are out there, they're distracted because of the demands that are related to the mitigation measures and rising crime. We know in our world today, it's an ever evolving chaotic evolution of everything that's going on. So they're being distracted. So those individuals who are typically the ones that, we can look at to continue to protect and serve are being distracted from that. So how do we respond? Healthcare professionals in particular, the frontline folks, are the ones that have the best ability to identify and to be able to find the resources for those that are being exposed, those that are being coerced, those that are being abused. When they come into our purview, whether it's through the emergency room, whether it's through a physician's office, be it, OBGYN, or be it a dentist, or be it, a primary care, we have the ability to be able to help, and with the pandemic, a lot of individuals in the healthcare industry were not seeing people in person. Obviously, if you come to the emergency room, you're going to be seen by person, but there's also limitations there too. But we have the opportunity, and it's vital for us to be able to do things like this through telemedicine. I mean, telemedicine, we've never seen a pivot like we did. I mean, telemedicine has been around for, 10, 15 years, but everyone now has the ability to see a provider and get help through telemedicine, whether it's behavioral health, whether it's psychology, whether it's counseling, whether it's urgent care visit, or a primary care visit, or even a specialty visit. All of our physicians these days are able to do that. And all they have to do is to ask the right questions. We have the ability to do COVID-19 testing immediately. Everyone that comes into the healthcare environment is immediately tested to see whether or not they have the virus. And we have the opportunity now to be able to provide vaccinations. It's just starting, and there's a little bit of a confusion about how we're going to be able to distribute it to the masses, but the healthcare providers are being tasked with figuring that out. And I think that we're doing a great job, considering that it's only been 2 to 3 weeks since we got the initial virus vaccinations. And, so it's just a matter of time before we can begin to inoculate everyone in the general population. Obviously, there's a need to get the frontline workers and the more vulnerable taken care of first, but it will be available for everyone. So how do we get those that aren't really on the radar seen, is something that we have the duty to figure out. And of course, utilizing trauma-informed approaches. Being a healthcare provider and seeing someone go through this process through their eyes, I realize that there's a lot more that we can learn. There's a lot more that we can identify, when they come into our care. It's not like, well, what happened to you? It's more like, how can I help you get through what happened to you and tell me about it? How can I respond better so that I'm not just looking at you as a disease process, or as, someone that's been in my emergency room several times now without asking you why, why have you been here several times, and only treating the symptoms and not the person. So we have an obligation to be able to do that. We also want to utilize the public health approach of identifying the problem and the intervention implementation. And what I mean by that is, like, there's a very specific process from the public health approach. We assess the surveillance component of it is number one. And so we find out what's the problem. And we ask a lot of questions to figure that out. And then the second part is identify the risk and the protective factors. So what are the causes of the problem that you're coming in to see me for today? And then the next step is the implementation. It's like scaling up the effectiveness of the policy and the programs of what we have to be able to figure out what do you need and how can I help you? And then we want to develop and evaluate the interventions. So what works for you in particular, and individualize that plan of care that we're looking at for that particular person. So those are the things that, we're obligated to do as a healthcare responder when we're seeing those individuals that we just think that there's something more that could come from that. And we want to target both the potential victims as well as the exploiters, because again, the exploiters are the ones that are putting the victims in those potential dangerous situations. So we want to be able to communicate to them the dangers of what they're doing. And even if, we don't know for sure whether we think it's a relative or a mother or brother or, a friend, being able to communicate and say, you know what, this is a crazy time right now. So you might want to make sure that you're taking care of yourself and help your friend, your loved one, or whomever you're with, to be able to do the same. We want to guide them in the harm reduction principles, which is, making sure that they do wash their hands. If they can get a mask, to wear a mask, to participate in social distancing, to be able to prevent as much as they possibly can, in any circumstances, because we know that works. We've seen multiple people, that if they use the appropriate precautions, it will help. We want to educate everyone about sex and labor trafficking. So again, not just the folks that are coming in through our doors, but each other, so we want to be able to have that available in whatever environment they're in, and, to make sure that we're communicating that to everyone and letting the perpetrators know that we got your number, we know what's going on, and we potentially can report you. We want to be aware of the local and national resources available during the pandemic. So, some of the local organizations may have had to close because they didn't have the resources to keep track of. But we want to make sure that we know if the national organizations are available and we have the phone number that are reachable, or if there's local organizations like Elite Foundation, and as Angel will talk about our iCare line, to be able to provide those resources to the individuals that are coming in. If they need housing, if they need transportation, if they need food, that they have the resources available to help out. And also, we want to make sure that every single colleague that we work with is aware of what's going on. And, we want to make sure that the public is aware about the issues with collaborating agencies, because again, human sex trafficking is a pandemic all on its own. And COVID has just kind of expanded that, so we need to, number one, be able to educate everyone about what's happening, and especially now where there's more vulnerable and more opportunity for them to be the ones that have difficulties through this pandemic. And again, as healthcare providers, we know that there's mandatory reporting if we know that there's imminent danger. So you cannot forget that. If it's a minor, then it's obligated, no matter if it's imminent or not, if you suspect any type of abuse or neglect or exploitation. But from an adult perspective, if you know that person is in danger, you're still responsible to report that to the law enforcement agencies and the adult protective agencies. And then there's always the opportunity for, even though they may leave there and say, I don't need help, being able to give them online support groups or peer groups is extremely valuable to them, because who knows, they might be able to call that and find someone that is able to help them. Elite Foundation has a survivors council, and there's the opportunity to talk with people who've been through this that might be able to help. The sex trafficking, sexual exploitation is a pandemic to begin with, and now we've accentuated that with all of the rules and regulations that have come around COVID. And so that being said, I'm going to ask Angel some specific questions about this. I want to hear from her the experience that she's gone through, with this. So, Angel, what was your experience of healthcare while you were dealing with the situation with your daughter? What did you experience from them?
Thank you, Wendy. That was such amazing information that you gave us today. So thank you for that. I learned a lot. Great question, by the way. So as you know, I said earlier that I am the mother of a daughter who was trafficked. My daughter's name is Alexis. I didn't know that she was trafficked when she was being trafficked. And I'm going to get deeper later, so I'm just going to kind of skim over right now a little bit. This is a dark situation, so I'm going to be open and honest with you guys.
Thank you.
I want you to hear my heart, and I want you to hear the truth, because this is not a laughing matter. This is not a beautiful matter. Human trafficking is an ugly thing. It's a painful thing, and it's real. It's what's happening in our world today. And it happened with me, and it happened with my daughter. So that being said, with your question, what my experience was when it come to the health care and my daughter and trafficking. Well, my daughter was being trafficked, and I'm from South Carolina. So in South Carolina, you can be the age of 17 years old to move out. So I'm thinking that my daughter moved out at 17 years old. She all of a sudden wanted to move out. There was no changing her mind. She wanted to go, so that's what she did. And little did I know that she was being trafficked and she had to leave. I'm not sure still to this day whether she was being threatened or the family was being threatened, but I do know that she had to leave. And she came home one day. She was allowed to come home one day, and she stood in front of me. This is very hard. She stood in front of me and she said, "Mom, I'm in pain." And I said, "Okay, where are you in pain?" And she said, "I'm hurting in my private area." And I said, "Okay." I said, "Let me see it." And she was very embarrassed. She was ashamed, and she did. She let me see it. And she had blisters all over her, just all over her legs, her inner legs, and private area. So at that moment, I said, "Lord, whatever this is, I pray that you protect me." So I took my daughter at 17 years old at this point, and I washed her. I put her in a bathtub and I bathed her. And I felt like, okay, it's time for her to go to the doctor. So I took her to the doctor, and they did what they did. They looked at her, they evaluated everything, they took tests, blood tests and everything, and the test come back that she was positive for herpes. But they didn't involve me. Here she is, she's 17 years old, and in South Carolina, being 17 years old, it's underage. So even though I signed for her to get all the help that she needed, the blood test, the medication and everything, they did not involve me. They didn't give me a phone call with the results. They phone called her. They didn't involve me in the whole process. So she's the one that had to tell me the end results, that it was herpes. I'm still waiting right now to this day, 3 years later, and do not know the full results of the outcome. My daughter did not make it. My daughter has now been dead 3 years. Sex trafficking took her life. And as a mother, trying to find out all the results, I cannot get the end results. I've been trying, and the healthcare providers told me that it was the health department. The health department told me that I needed a lawyer to get her results. And my daughter is underage. She was 17 years old. I signed for her to get the testing that she needs, but yet I still can't even get the results to this day.
So Angel, that's just like, I can't imagine what you've been through. And thank you so much for sharing that story. I mean, it has to be very difficult still for you to be able to do that. What could we as healthcare providers done differently to help support you and your daughter in this horrible event?
That's a great question, Wendy. I feel like to involve the parents more. If your child is underage, let them be a part of the process. Because I know my daughter, she felt shame and embarrassment, but I was there as a mother. You were there for your child. You're going to be there for them regardless of whether the outcome is herpes or AIDS. You want to stand by your child. You want to support them. And so I would say to involve the parents more in the process. Yeah.
Right. And being able to identify, how that parent is feeling at the moment, because that's their child.
Right. Mm-hmm.
And wanting to do that. Well, thank you, Angel, for sharing that. Is there anything else that you would say to healthcare providers and the public in general in terms of, what's going on today with the pandemic and all the things that I talked about, where we know that there are people that are being even more exploited, if that's possible, than they were before, because of the situation that we have. And any words of encouragement or any words of, just like plead for help from healthcare providers and public health, and being able to identify those survivors that are out there that need assistance.
Yes, I would say ask more questions. Ask more personal questions. Just make sure that the patient is okay, that truly okay. Let it not just be a job or another patient that comes in the room, and checked off, done, but truly care about the patient, because that patient could be a person that's being trafficked, just like Alexis. She had a secret. She was being trafficked and she couldn't come home. The healthcare providers didn't know it. I didn't know it, but her eyes told it. So I would say just care more. Yeah.
I think that's perfect. That's perfect. Because again, we have to look at the person that's coming into our care as exactly that, a person that has feelings, that has a history, that has things that are going on. And it's not just a diagnosis. It's not just, they're back in our practice or in our emergency room. It's a person, and there's a reason why they're there. So thank you, Angel, so much for sharing that story. We love you and know that, you're there to help us do exactly that. Okay, so what I'm going to do now is I'm going to show you an introductory film to our brand new program that Angel is the lifeline for us. I mean, she will be answering your phone calls. She will be, directing you to the care and the resources that you need. And so I'm going to cue up a video, and then we're going to talk a little bit about it afterwards.
Hi, good evening, everyone, and thank you for joining us on January 11th for our Elite Podcast and Live. We're so excited about being able to do such a special podcast and live on January 11th, which is the National Day of Human Trafficking Awareness and Prevention. This entire month actually is set apart in order to bring national focus to this crime of trafficking in persons. And this evening, I have the privilege and honor to have one of my colleagues online with me. Please warmly welcome Angel Carter.
Hi, everyone. My name is Angel Carter, and I'm the Victim Advocate Care Manager for Elite Foundation. And I'm so grateful to be able to launch the iCare line with you guys today.
After working with victims and survivors of human trafficking and sexual exploitation for several years, the one theme that consistently has risen from those we served has been that they lacked a point of entry where they would have someone on the other side of a phone who would be able to actively listen to what they needed, provide some direction, some counsel as to where to access services, and to connect them back into community. That was the rise of the iCare Access Line. Over the last 2 years, Elite Foundation has been developing this cloud-based access from anywhere service that will be manned 24/7 by a survivor leader who is trauma-informed. The iCare Access Line is here because you are not alone. We are here for you. The iCare links caring people to people, people to services and people to community. It is real-time access to a survivor leader who is there to actively listen and act to intervene to support you in connecting with services and community.
We're dedicating this today to Letty's promise, to Letty, my goddaughter. Letty, I love you. I miss you.
We're also dedicating this to Alexis, my daughter. Alexis, we love you and we know you're shining down on us.
I pray you'll be alright and watch us where we go and help us to be wise in times when we don't know. Let this be our prayer when we lose our way. Lead us to a place, guide us with your grace, give us faith so we'll be saved.
So Angel, thank you so much for participating in this. And I know that it's a hard video to watch, you know, because your daughter was in there. But can you just share with us what this iCare line means to you?
Yes, that's a beautiful question. iCare speaks for itself. iCare, as a survivor that's been trafficked, as a mother who lost a daughter who has been trafficked through trafficking, iCare. That's the thing. So through the iCare line, what I'm hoping to succeed is in helping the survivors to rise up, to get the healing that they need, to get the resources that they need. Too often do we lose those who've been trafficked because they come back from being trafficked and they can't handle the pain and the shame that they carry, and some commit suicide. So it's a very, very dark thing. It's a very heavy burden to carry. They don't feel worthy. They don't feel loved. So what the iCare line does is it connects them to the resources that they need to begin a new life, to have hope again, to feel like they're worthy again, that they can be loved, that there's someone on the other line that cares, that truly cares, they're not just another number or a statistic, that they're a person that is loved, that we want to get them the best resources possible.
Absolutely. And you're the perfect to do that.
Thank you.
Your heart is so big, and that, you know, your desire to help those that are going through this, because you know what that looks like. So thank you so much, Angel. And thank you, everybody out there. We're so appreciative of all of you, and hope that this hit home, you know, and that you understand now a little bit more about what the Elite Foundation is set to do. And we're excited to roll out our iCare program with Angel Carter at, you know, at the helm of things, and all of us there to support her and you and everything else. So thank you so much for watching, and we'll see you soon. Okay, that's it.
We didn't even have to do that over. What?
We just had to like stop a couple times and get our composure.
We're professionals. What? Oh, thank you. That was so emotional. Oh,
I know, sweetie, but that's, you know, that's cathartic. That helps get through things. And
it was. And the conversation you had with me prior to this is what really helped for my answer with the iCare, because you know. I didn't want to go off too deep, but yeah, I wanted to be real. And I know that Jess said that at one point she was going to only say so much on the 11th, and then on the 12th she was going to go deeper. But then the video shows the in memory of Alexis. So that's when I had to throw in that I lost her because I wanted to match the video.
Exactly.
Right.
I think, you know, it's meant to be the way it's meant to be. You know, we always have plans, and then, you know, he's like, no, this is what you do. And so we listen.
Yes. And do you know that she did not know anything about the healthcare system with Alexis? I've not mentioned that to anybody.
Oh, wow.
So that was all God. And a question, because what if I didn't have a story with it? But I ended up having a story. That's why it wasn't mine. It was my daughter's, because I really did. I'm still fighting right now to get her results back for HIV. I can't get them. They said I need a lawyer.
Really? Were you
Yes.
a healthcare advocate at all? I mean, did she sign
No.
up if you had HIPAA? Like you could get some of the records?
No, it's all I know is we went in to do the testing, and I signed for her because she was an underage. And now that she is passed away, I can't get anything. I can't get records. I can't get nothing. So I don't even, they came to my house after she passed away trying to get in touch with me. And I was like, uh-oh, she must have been HIV positive. What? Okay. Because they were trying really hard to get in touch with me, but I had came to Florida to get help because I was so broken from that. And now that I tried to contact them and even go up there and say, you tried to contact me with results. My daughter is no longer living. And they told me they cannot give me results without a lawyer pursuing them. And I'm like, she was underage though.
Yeah, that doesn't make sense. And especially as a minor, she doesn't have to sign a HIPAA form. I mean, basically you are her advocate unless she was emancipated, which I don't
know.
know.
I signed everything.
Yeah, that doesn't make sense. We'll have to investigate that.
Yes, because I'm still wondering, was my daughter HIV positive? What if she knew that?
Right.
Like, what if that's one of the things that she carried? Like, I don't know the burdens that she was carrying in those last days in her heart, but would it change anything? No, but like I said, the biggest thing for me is to let the parents be more involved. I really believe that with my heart.
Well, and
I do.
That's a form of care as we as healthcare providers look at. It's like, it's just informed care, and especially around children. It's like, that's just the way we do things. So
yeah.
Unless they're emancipated and totally, on their own, and there's no rights for things. So